submitted, and they also received the federal pandemic unemployment compensation agreement. And we are in discussions with the Department of Labor to get that program going. In the meantime, what we have done here is we have prepared our processes so that once we get the monies and once we get the okays and the approvals, we can push them out as soon as we can. So if it's anything that I can do, I will certainly do it with the best of my ability. I know people out there have been very upset. They have been very, very scared. It's like they have nowhere to go but to rely and wait for this. And again, the delay is something that I I have not in any way intended to do. It is certainly, like I said, I was very angry, upset, frustrated about the delay.
Thank you, Governor. Nestor, if I may, we have this coronavirus relief fund guidance from the Treasury. They also put out a fact sheet, and they've been updating the fact sheet. And it's the governor's request, my responsibility primarily, to put together the spending plan and make sure that it's consistent with the guidelines, make sure that the cost allocation, Kevin's question about DOC, I understand paint might not be an immediate COVID-related thing, but when you're rehabilitating a facility at DOC to house COVID inmates, you're certainly going to need to ensure that the place is up to par. So I had a painstaking review by my staff with all the agencies asking for input. It took a while. The governor was saying, "Are you done yet? Are you done yet?" She was as anxious as anybody to try to get some spending document together such that she would feel comfortable. And then now we're at a point to where she's ready to pull the trigger and make these funds available as outlined. So it is a matter of accountability, transparency, and it's a budget thing. So I had to take the time that I had to take. I wish I could have done it a little bit sooner, but we wanted to do a good job, and we think we did a pretty good job.
Thank you, Nestor. Next is Guam Daily Post, Matt O'Connor.
Hello, Governor. Hello, everyone. Can you hear me?
Yes, John.
Okay, thank you. Before I ask my questions, I just wanted to clarify the answers made earlier to Nick's initial questions. Governor, you're maintaining that the use of NRC's signature was legal?
The use is what?
Legal. Legal.
Yes, what about it?
Sorry.
Is it what?
You're maintaining that the use of Linda DeNorcy's signature was legal.
I'm maintaining that it went through our protocol. I'm maintaining that it went through the process that we normally do, and it is acceptable way of doing business.
Okay, thank you. You also mentioned that there were two individuals at the hotels. Can you name who they are and why they were selected?
Sure. One of them is Alice Tyron, and the other one is Rebecca Respicio. These people are my cabinet directors, and they were selected because they're responsible people. They're selected because they're very organized. They were selected because they were very competent, and they were selected because they're very compassionate for our people.
Thank you, John.
Did they volunteer for the position or were they selected?
We put out the call for people to help us, and they did respond.
All right, Governor. Thank you. I'll move on.
Thank you.
Okay, thanks, John.
Pacific Island Times, Marvick. Governor.
Hi, Marvin.
Hi. So, last week, Senator James Moylan introduced two bills that would provide direct assistance to microbusinesses and employees who have been affected by the crisis. One bill proposes $20 million economic support program that would give 800 to each employee, and the other bill would provide a grant of between 2,000 and 10,000 to small businesses. Will you be both bills will use the COVID funds? Will you be supportive of this bill, or do you think this is redundant?
We already have this program in place, and so I think his bill is moot because it's the same program.
Oh,
It's providing assistance to individuals, and it's providing assistance to businesses, to include micro businesses, to include sole proprietors.
okay, thank you. I have a non-COVID related question. The Supreme Court, I'm sorry, I have to just insert this question. The Supreme Court denied Guam's petition to review the Ninth Circuit ruling. Can you please comment on that?
Well, it is a disappointment, but it is what it is, and we would have to. I just read it this morning, and I haven't really had the time to regroup with our legal people, but I am going to be meeting with Melvin Borja, who heads the Commission on Decolonization, and regroup and see what other options we have to move forward on. So we could do legislation, we could amend the legislation, we could do something with the legislation that would address the Ninth Circuit's concerns about the legislation, but we are going to move on with the plebiscite.
Thank you.
Thank you, Marvick. We're going to go into our second round. Back to I-94, Adriana Cotero.
Hi, so I want to go back to a few things Nick addressed in the last round. While yes, the media and people have since received an apology from Lieutenant Governor Josh Tenorio and your policy director, Carlo Branch, and I do appreciate it, but I want to ask you, Governor, did you support the decision to censor the media and the action by your communications director, Janella, to press mute on our questions at last Thursday's press conference? And do you also plan to issue an apology at all for not answering the media, more so the people?
So let me just say, Adriana, that I give great respect for my director of communications and policy for being very forthright in apologizing. I also have great respect for the lieutenant governor and very forthright in apologizing. There was no intention of censorship at all.
Did she apologize?
There
How about
was
you? Gonna
no
apologize?
intention of censorship. The fact that it was muted, it was muted because I know the guidelines were certain guidelines and it wasn't being followed. And that's, it is what it is, and people have apologized. And so I am going to be together with great respect, honesty, truth. Yes, I apologize for the mistake that happened. People make mistakes, government makes mistakes, but I am not ashamed to say we made a mistake, and so I
You
apologize.
should be ashamed.
I appreciate that apology, and I also appreciate that you guys opened the it to unlimited questions for today, and realizing that we are a voice for the people of Guam, and as public entities are rightful to. I do appreciate that. Thank you. So for my follow-up, going back to your other answer, saying that 2 of your cabinet members oversee PACSTAR, the quarantine and isolation facility, but can we get a breakdown of all hotels being used as quarantine isolation facilities, and who, if so, are any other government staff performing these house parent tasks for each facility? What are their hours of operations? What further details can you give us on the work being done by the government staff? And are we paying for these rooms if they're not occupied? I know in your budget breakdown it allocates $4 million for quarantine, so has this been paid out yet?
So The other facilities is the Wyndham and the Days Inn. I don't know the people who are there. I don't know their names. I know that they are government employees.
You don't
I don't know
know?
their hours. I don't know
What
their
do
schedule.
you know? Only
we
the
can get that
money.
and give it to you. So I can't answer that part. And yes, we have been paying. Lester might maybe have
From
more
what?
to say
From
to
where?
that. But we
Where's it
have
coming
set
from?
aside the monies to be able to pay for the services.
Yeah, can you say which hotels have been paid then?
You know, I don't know. I'll have to check with the Department of Administration. They're the ones that do the checks.
Okay.
Thank you, Adriana. The Point, Nick Delgado.
She don't know. She don't know what it is. But I thought only two.
Update again. Can we get a comment on the relapse of our COVID patients? I believe it's 7 was the number last time. Are we to expect more from those who were reinfected with the virus? And where are we with retracing where they've been? For those 7.
So the 7 that became positive, Nick, when I was talking to the doctors, this has occurred, and what has happened is they say when the virus dies, they still shed their RNA, and so when you retest, they'll pick up the RNA and they'll pick it up as positive. They did also say that most of the literature says that it is not contagious, but we are being very conservative and being very cautious. So we are isolating these individuals again, and we are also doing contact tracing.
Okay, so as a follow-up to that, why were they considered recovered before being required a follow-up test?
Because when they were in isolation and they met the requirements set by CDC guidelines in terms of recovery, they met those guidelines, and then they were certified recovered.
And real quick before I move on to the next reporter, I just wanted to clarify John's question. The 2 directors staying at the hotel, they of course would be qualified to get the 25% hazardous, correct?
That is correct.
Thank you, Governor.
Thank you, Nick. PDN, Stephen Tiaco.
Yeah, sorry, the computer problems. Thanks, Governor. A follow-up on Programma Salapi, is that it sounds like a one-time payment, is that correct?
Which one? The Programma Salapi?
Yeah.
Yes.
So one-time payment with check starting this Friday. And then for the businesses, so GIDA's going to be deciding how that money's distributed. Could you explain that?
Yeah, we're currently, Steve, developing the program, and
They're
obviously
always
that's
in the
subject to
planning
governor's approval.
stage. Nothing set in stone again.
Okay, great. And just a follow-up on the safe haven, Governor.
I'm sorry, Steve.
Yeah, for the safe haven.
Yes.
So what exactly was the problem with the Paseo Stadium? Like what were the issues there, and what other sites are you looking at as a result?
Yes. So when I actually was given the progress report and the bathroom facilities and the shower facilities was not ready, I did not want to bring the homeless there when those facilities aren't ready. Additionally, when public health went to look at it also, and with the guidelines of homeless, what happened was that we were told and advised that the most effective way of dealing with our homeless is to put them in a hardened facility. So that's what we're looking at now. We're looking at other places where we can use structure. And we're in the process of looking at various sites to do it. And so that basically was what was the concern there with the safe haven.
Thank you, Governor.
Thank you, Steve. Thank you, Steve. Mariana's Business Journal, Wayne Charkaloff.
Hello again, everyone. So, hello, can you hear me?
Hi, Wayne.
Hi. Hello. Okay. So, one of our readers has a question. They cited some CDC statistics saying that the national average for positive COVID test rates for clinical labs is 10% and 15% for commercial labs, where Guam's daily positive test rate is less than 3%. So his question essentially amounts to, given those statistics, wouldn't it be, is Guam being too conservative in its approach to reopening? And is it perhaps incurring too much economic damage when its rate of positive COVID cases is so much lower than the national average? So what would you say to that?
What I would say to that is we did a good job. And we did a good job because our rate is only 3%. And we are very fortunate that we did a good job. I would hate to go into the reality of what was being projected with thousands of COVID cases and hundreds of fatalities. And that's why we were very prepared. And for me, I would rather be very prepared, overreactive than sorry. And so we are following guidelines that have been proven to be good guidelines. And we will continue to do that. And we will slowly and methodically reopen till we're assured that we have contained this virus. And I'll tell you, I'm very confident that we will. What does worry me is everyone says there's going to be a second wave. And we are projecting that the second wave isn't going to be till October. And so these next weeks are going to be very telling in how we are going to move forward with the reopening of our island. You don't mess around with this virus. They're even saying that it now does affect children. And they're even saying that when it affects children, children get seriously, severely ill. So I am very aware about our economic health. But we cannot have an economic health if our people are not healthy. We cannot have an economy if we don't have people. And so the focus, yes, is on the health side, but I am also very much concerned about our economic health. That's why every time I push about all of these programs that we are bringing forward, and I've been in close communication with the Chambers of Commerce, the Women's Chambers of Commerce, the business community, and we are working very closely to see how we can best balance the health of the individual and our economic health.
Thank you.
So it's not overreacting.
Okay, thank you. And for my second question, has there been any talk of prioritizing testing for employees who work for essential businesses, for instance, people work in grocery stores, restaurants, considering that they have so much contact and exposure to the public? And if not, would you consider such a program?
Absolutely. We're trying to make our way to that level. And so we looked at what our priority testings first. And of course, we did more of the seriously ill from the hospitals, and we're still doing that. We did mostly from the clinics, what our testing inventory was, and we were very resourceful. We were very limited in our resources, and so that's why we decided to do the most serious ones and the more critical ones and the much more impactful ones. And so now that we have the expanded testing, we're moving out into the community. And as you can see, we started up north, and we were allowing people to come. We then went to the central, then we went to the south, and we did that because we wanted to have an idea of what the community spread is. We're now going into clusters of living, and we've done the Himalayan apartments. We're going to be doing the barracks where the workers live. We're going to be doing St. Dominic's. We're going to be doing senior citizen homes, the Guma Tranquilidad, and the other villages where the seniors. We're going to be doing over 100, 200 seniors, and so that's what we are working towards. And of course, we are doing our first line responders, and once we have more tests coming in, we are looking at all those individuals that you were talking about.
And thank you.
Thank you, Wayne. Next is PNC, Kevin Kerrigan. Hi, Kevin. You can go ahead and unmute yourself. No, he's there. Kevin, Kevin, we'll go back to you, Kevin. Okay, we'll go back to Kevin. Patty Arroyo with KFD7, are you still there?
Yes, I am. Thank you. The Safe Haven program, according to the expenditures report, is allotted at $250,000, Governor, or Lester. What is that going to be for, considering now that we have gone backwards on the choice of Paseo as a homeless shelter?
Thank you, Patty. I think the governor responded to that question. We're looking for a hardened facility, one that that lends itself more to social distancing and some separation, as opposed to the openness that Paseo provided. So we're actively looking to see if we can find a facility that will be conducive to providing this safe haven.
Sorry, I did hear that response. Can I do a do-over?
Sure.
Okay. So the question then would be, is the homeless population, in light of the fact that the homeless population is the least of the worries of positive COVIDs, a huge priority for $250,000?
The least priority? I'm not understanding your question.
Well, they're not a highly susceptible or suspected case demographic.
So, Patty, we are concerned about the homeless because we have had 2 positives. And the thing is, after you isolate them, where do they go to? And the concern there is they also are traveling all over, and they don't have I see them because when I go for a walk at Paseo, they don't have masks, and they sleep in a group and so forth. So we are concerned about them being possibly a very high risk in terms of transmission of the virus.
Okay, thank you for that. Governor, another just unrelated to the conversation about COVID, why did Pilar Laguardia leave GBB?
Damn.
I
haven't seen the resignation.
I'm really sad that she decided to retire. She's retiring, and
That's
I
not
don't know
retiring.
whether
That's
it's the
resigning.
COVID situation, with this, what people have done is they've reflected and they've looked at, hey, there's more to life than just working. And so, but I don't know if that's the case. She just felt she has given 41 good years to GVB, and it's time for her to do other stuff, and she'd like to move on and do other stuff, spend more time with her daughter. She was talking about how her daughter's wedding had to be canceled, and so I think I'm thinking this is not what she said, but I'm thinking she had inner reflection on what
Oh
she
my
wanted
God,
to do.
Governor.
She told me her age, and I didn't believe it, but she said, oh, she wants to be able to live the rest of her life in probably a less stressful situation. And I totally respect that. I told her that I wouldn't get in her way, but I'm very sad that she's leaving because she has contributed even just in the last year. She's brought in the numbers. She's very well respected in the international arena. I've been with her in Japan and South Korea, and people respect her. People look up to Pilar, and when she's making a presentation or she's conducting a meeting, they hold her opinion with very high regard. So we are going to be losing someone very good in the GVB industry.
Can I just ask one last question before I go to sleep? I just want to find out. It's been a long day, ma'am. I just want to know. I know. I hear you. Lester, who reviews these expenses? I have noticed, and I'm going to kind of call you out because I know you can handle it. An $895 laptop bag seems to be an extravagant expense on your spending plan. Can you just address that, please?
The amount and the purpose is reflected in the agency submission. So when we get down to the actual expenditure and we deem that the expenditure would be better served in providing another laptop as opposed to a cover, then we'll certainly do that. But in the interest of transparency, when we could have hid the comment section, we could have just given you guys the numbers.
You could have, but
wouldn't
didn't.
be consistent with the governor's promise of being transparent. So what you see is
these
what we
people
got.
Something's wrong with them.
But will I approve of a $895 laptop bag? Of course I won't. But
it was from your department, Lester. It came from BBMR.
But there was probably
Sorry, Lester. It came from BBMR. That was the. Yeah.
But what am I going to use the $895 for a bag or several bags for this teleworking initiative that is throughout the entirety of this? The answer is no.
Thank you, Patty. KUA, I'm Nestor Lecanto.
Yes, thank you. So I want to go back to the reopening on May 11th of non-essential businesses. Will this include government of Guam, and how much of the government, percentage-wise, will be reopened?
Yes, it will include the government, and we're looking at those services that are services that help support the businesses, like, for example, Department of Revenue and Tax, DPW, DOL, DOA, and we're not really having everybody come back at once. We're gradually going to be allowing them back. But also, we are going to be reconfiguring our office space. And we've also are going to be, if it's a customer facing kind of service, probably put in barriers there. And of course, we would require mask and social distancing among the workers.
And have you already identified and advised the employees when they're supposed to come back to work?
No, we haven't yet.
Okay, but it would be May 11th, simultaneous with the reopening?
Yes.
Okay.
Thank you, Nestor. Guam Daily Post, John O'Connor.
Yes, thank you. I just want to follow up again on the safe haven program. Governor, I believe Senator Moylan sent you a letter on, I think, Saturday. Have you responded, or do you have a response to that letter? And do you know why it took until Friday night to make the decision that Paseo was not suitable for the program?
I have not seen his letter. It was up till Friday night because people were still saying that they were able to meet the Saturday deadline. But when I saw based on press reports that that wasn't going to happen, that's why I decided to delay its opening.
That decision came from you, not to use the Paseo Stadium?
The
Is that from
decision
you or public health?
did come to me. I made the decision. I told them we weren't going to open because, again, the place wasn't ready, and that's why we didn't open right there at the Paseo.
Okay. I do want to go back to one of the earlier questions during the first round. I know, Governor, you stated to KOM's question something to the effect of that you've acted within the law when it came to the procurement of the quarantine facilities. And you've also were going through FEMA with all that. But when it came to this procurement, when it came to your legal counsel, Mr. Hyde, procuring the quarantine facilities, and when it came to the advance payment of these facilities, some of whom have been paid, did that occur with the concurrence of the AG?
That
Was the
occurred.
AG? Sorry, please go on.
I don't know if it came with the concurrence of the AG, but we did act within the guidelines of the law, as declared with the Public Health Emergency Act.
So do you know how the payments can be validated if the contracts and agreements with those companies have still not been signed off on by the AG? They haven't been finalized yet.
The payments were verbally agreed upon. It was $100 per room, which included food, 3 meals a day, included linen services. I thought that was a pretty good deal for $100 a day. And we wanted to quickly secure the place because we needed to house the people that needed to be quarantined. I wanted to make sure that our people were protected against these people who have traveled in hotspot areas. The time Philippines was really increasing in their COVID cases. Additionally, Japan was also again increasing. It was getting reinfected. So my main purpose and focus was to make sure we had these facilities, to make sure that we protected our community, to make sure that we wouldn't have a great increase of community spread. And so using my public health emergency authority, we acted within the legal confines of securing this piece of property for our COVID quarantine.
Thank you. And real quick before I move on, your signature is on the letters to the quarantine facilities along with Linda's. But were you involved in selecting the quarantine facilities?
I was not involved, if you mean that I'd go out there and look at them. No. I had people that could do that. They went out and selected. And I'll tell you how it was selected, and I'll repeat it again. When we needed this piece of properties so that, again, we can protect our community, my legal counsel went out and worked with Mary Rhodes from the Guam Hotel Restaurant Association, and Mary knew what our budget was. And so
Mary.
she put out a call through her network of people, and only 3 responded. And the 3 that responded, when I got the numbers and the volume of rooms, and when we looked at the potential numbers of people that we needed to quarantine, it met our needs. And we didn't have
And
the
the bank's
luxury,
needs.
John, of going around and looking for places, because we needed to secure the property immediately.
Oh, because Guam
And
is
that's
500
how it
miles
was
long.
selected.
Governor, in the end, there were 4
Oh
hotels.
my God.
Is that
There
true?
were 3 first, and then we needed more volume. We needed more place, and then the 4th one came out.
Okay, thank you.
That was
Thank you,
planned.
Marvin
so it doesn't look
has asked
like it.
to skip her for the next round, for this round. So we'll go back to Adriana.
Governor, can we please get this attitude every day? I like this
Kevin's
governor.
also, yeah, skipped this round as well. So we'll go back to Adriana, I-94.
Hi. So yeah, before I get to my questions, real fast, if we could just clarify who is acting GVB CEO then?
There is no acting right now because Pilar is still there.
Oh, is there someone being eyed then, or?
I am going to be discussing that with the chair of the board.
Okay. So then for my first question, how much are we budgeting for the independent third party to review federal spending? And will this be put out to bid or procured otherwise, even by your legal counsel?
So we are in discussions of procuring. We haven't really talked about the budget, because what we needed to do is do an RFP and put out the scope of work that we want, and then the proposals will come in.
Okay, and then within your expenditure plan, it calls for $7 million to be paid to American Medical. Hello. Sorry. So it calls for $7 million to be paid to American Medical Center, FHP, SDA. So how much is being paid to each of the facilities, and was there an MOU ever finalized?
There hasn't been any numbers that have been decided. We estimated this, and so we put it in there as a budget. As you know, budgets are a budget. It's a plan. So we don't know exactly if it would be 7 million, but I wanted to put enough there to make sure that we can provide the financing. And just to let you know that the CARES Act does include medical expenses related to medical services by public facilities, hospitals, clinics, and other similar facilities. So as far as the memorandum of agreement, that is being worked on. So we don't have one signed yet. We are still in discussion.
If I could, real fast, can you say why the $7 million payment is? I know you said it's not finalized, but why is it more than the expenses for Guam Behavioral and Wellness Center, GPD, GFT, GMH? They're combined as $5.8 million.
Right. So this is giving it to a medical clinic, and this is for services and expenses that they have incurred or will incur as a result of being part of the Cures healthcare delivery system that we have. They are the first line of first line of defense. They are the ones that are going to be triaging. They have already triaged, and they're the ones that are testing. They're the ones that are providing the specimens and so forth. So the services that they have and their professional services that they have, I certainly do believe it could come up to 7 million.
Okay, thank you.
Thank you, Adriana. Oh, go ahead.
May I add that the CARES Act funding, if you have a personnel costs in GPD, DOC, You can't supplant that with the coronavirus relief fund money. So, to the governor's point, we needed these facilities. They're providing great support for the overall effort to address the COVID pandemic. But the analogy of taking, well, that's more money than the other people get. Well, it's because this funding is supposed to be in addition to and not supplanting, and it's unbudgeted, and it says it's specifically due to the public health emergency. So it's like apples and oranges to say, you know, somebody's getting this and somebody's getting more.
Thank you, Lester. Next is the point, Nick Delgado.
Today again. So in the $117 million spending plan, $299,000 was set aside for the purchase of 10 vehicles. $5,000 was set aside for Guahan Sustainable to help farmers. But there isn't much for setting aside for food or food banks for those in the middle class who are not qualified for programs like SNAP. What's your comment on those who believe you are leaving the middle class behind?
I don't believe we're leaving the middle class behind. We're putting about $40 million in to help those middle class. We don't really have food banks at the moment. If there is food banks, the monies would be directed there, but I don't think we have food banks. I know they have the SNAP program. Do we have food bank? I don't think so. So there is a program that we're looking at, Nick, with the farmers, and we are looking at, there's a proposal that we are looking at, which we would buy the products from the farmers and then give them out to our people. But that's a proposal that hasn't yet been put into place.
And maybe I can add to that the Guam Department of Education Grab and Go program, I think, is also funded in the budget, right? So that's going to be extended. Like currently, the DOE Grab and Go is until the end of what would have been the calendar year or the academic year, was mostly funded by USDA or federal funds. And so I think there's some funds in there to extend that into the summer. And so I think that also addresses some food security issues. I know that there's been already discussions as it relates to funding, and it's not a large amount, but out of GITA, we had requested the $10,000 for Guahan Sustainable toward those similar goals. So I know Lester, you might have something else to add.
Governor, you want to also note your Guam Green Growth Initiative?
We also have the Guam Green Growth Initiative that we are working very closely with the University of Guam, and that includes plans and programs for food sustainability and food security.
Okay, thank you. So what is the administration doing to expedite the applications for SNAP for those who are furloughed? I know some people who submitted applications since mid-April, they still haven't been given a status update on their application.
Okay, so I'm not aware of that. Nick, I do know that in discussions with Task Angel that there may have been people that applied for it but didn't meet the criteria of the SNAP program. But we're not using all of the criteria of the SNAP program. We're not looking into assets and all those kinds of criteria that is with the SNAP program. I do know, and I have seen it, where she told us it takes anywhere from 24 to 48 hours to process the application and to make a decision. So I'm not familiar with since April. If you know the person, maybe you can let us know and we can investigate it. So if you have the person's name, you can give it to Janella and we'll call the person up. because they may qualify for our local program also.
Thank you, Nick. Next is PDN, Steve Limtiaco.
No questions. Thank you very much.
Thank you, Steve. Mariana's Business Journal, Wayne Chargala.
Hello, everyone. Are there any updates on the status of the contact tracing app that was discussed earlier, as far as like when it's going to be unveiled and rolled out to the public?
So I do know that we've been working with the company, and I'm sorry I don't remember the company's name, but it's a Safe Path, Safe Place, and it is totally free. It is something that can be implemented and installed quickly. So you know what? I need to follow up where that is. Because of last week, I thought we were already getting into some kind of agreement with that application.
Okay.
So can we get back to you, Vanilla?
Oh yeah.
Okay. You can send. We'll follow up with you, Wayne.
Thank you. And the most recent round of testing focused on senior citizen centers. Will testing reopen for the general public again shortly?
Yes.
And when will that be? Is it reopened already?
We're gonna go in probably in another 2 weeks, maybe 3 weeks. We want to make sure we go around and try to get as many as we can through those identified populations that I just mentioned. But Linda and I were talking about it, and I did ask her that we need to come back again. And actually, the mayor of Agate also asked us to come back because the day that we were testing, it had rained, and he felt that not very many people came out, although there was like over 160 people that were tested. Yeah, they can also go to clinics, and we're also encouraging that. They can go to Northern Public Health Center, they can go to the Southern Public Health Center and the Central Public Health Center. And the Central one does a drive-through, so they don't have to get out.
Okay, thank you very much.
Thank you, Wayne. Patty Arroyo, are you there?
I am. Thank you. I am. Are you there?
Yes,
okay.
Go ahead.
All right. Gosh, I had another question and I just lost it. I apologize. That's what happens when you're staying up way too long.
That's because I made you laugh.
Well, you did. You're very funny in that way. Again, about the following up on the question from the other reporter about the Safe Haven program, Governor. Since we are not using the Paseo and you're trying to identify another place, then is there some kind of communication with any entities that might provide insight as to whether or not this is a viable cluster of people that is of great concern for the spread, since there are, like you said, have only been 2 positives? And do we expend that kind of money because of what the data and the truths are showing?
So we are communicating with, of course, public health. We are communicating with the coalition, the homeless coalition. And how I'm seeing this, Patty, is that if we do identify a site, I would like it to be a much more permanent situation. Either we lease the place for
Are you okay? Okay.
Well, there were no.
Okay.
It's a side joke, an inside joke. But anyway, so we once we identify the place and it's a hardened place, we look to it also as a more permanent situation for our homeless.
Oh, but this is not the funding that's going to be this $250,000 is not going.
this 250,000 is just for the period of the COVID crisis. We have other funding sources that we can use for looking for a much more permanent situation.
Just a listener just sent me a note, and she said she didn't think that it was appropriate to ask you, and I'm going to read it directly. Can you ask the governor if the items that were prohibited from being sold, including vapes, however it lists permitted businesses to sell cigarettes, it sounds kind of a pick and choose for only favored business establishment. I don't know about that part, but if whether or not vape shops will be able to sell vape products. Right.
Okay, so there's a actually they consider this also a public health issue with the vaping. There's a lot of literature that talks about the dangers of the vaping. And so there are organizations, Patty, of course, the American Cancer Society, Public Health, the Tobacco Coalition, people that are very concerned about the health effects of the vaping. And I think there is a law that already regulates it. I'm not too sure. I need to look at that.
Thank you, Governor.
Thanks, Patty. And I believe KOAM has also asked to skip this round, so we're going to go to Guam Daily Post, John O'Connor.
Yes, thank you. So, looking at the spending plan, it appears there are 3.5 million for credit card fees. I think this refers back to the team program that was made back in March. Why is it anticipated to have that much in fees, and how much is actually being collected by revenue tax during this closure?
Yeah, thank you for that question, John. One of the things that we did, the customer was paying the convenience fee. We made a conscious effort to, because of social distancing, to take on that financial responsibility. So if you're going to any Treasurer Guam office and you have a government bill to pay, other than the utilities who didn't have the convenience fee placed on the customer, you would have been paying, I don't know, $104 for a $100 liability to the government of Guam. We wanted to do two things. Number one, minimize personal interaction. And number two, facilitate the ability to do these things online. It actually works better for the government of Guam to immediately get very secure sources of payment quickly. And it also is a convenience for the residents because you don't have to get in a car during a kind of stay-at-home period to go pay your bills. So the estimated cost for the government to absorb the convenience fee is $3.5 million.
I see. Okay. Governor, can you clarify the status of the FPUC agreement, the Federal Pandemic Unemployment Assistance Agreement? Did U.S. Labor release and sign the FPUC agreement with Guam Labor? And if yes, when does Guam expect U.S. Labor to send the funding? And did U.S. Labor approve Guam's proposed $924 million budget for the unemployment benefits program?
So the FPUC, it's an addendum actually to the agreement. And I know that Dave Del Sola just received it this morning. So he actually sent it to me right before I came here. So he sent it to my office. So I'll be looking at that with him. Once we are okay to the addendum, we would sign it and send it off. The 924 million, yes. I'm getting it mixed up with the 945 and the 924. Anyway, it's a 924 million expected expenditure. That hasn't come to us. I think once the agreements are signed and once the implementation plan that Dave also just submitted, I think yesterday, then we could probably move faster. And of course, while doing all of that, we're preparing, we're training our people, we're preparing all our technology to make sure that we can do this online, because it's a matter of monitoring this program every week. It has to be recertified. People who are receiving the benefits have to have it recertified every week. And also employers have to submit reports to Department of Labor, such as who did they hire, and we have to reconcile it with our records. So there's a lot of going back and forth in terms of accounting and in terms of reconciliation.
Just to clarify that last bit, that wasn't clear. Did U.S. Labor approve the 924 million?
Not yet. That's
Not
just
yet. Okay.
an estimate.
Okay.
That's our estimate based on the number of unemployed that we are estimating to be.
Okay.
Thank you, Governor.
Thank you, John. Okay, and I-94 is also left or has skipped. Marvik says she has just one question. Go ahead, Marvik.
Just one, can you hear me?
Yes, go ahead.
Does the spending plan require legislative approval, or is it open for amendment?
This coronavirus fund is a fund that's given to either the CEOs of the states, and that's usually the governor, or it could also be the representative, official representative of the states. And so in our case, it's giving directly to Guam, and no, it does not need legislative approval.
Okay, thank you.
Thanks, Marvik. Point, Nick Delgado. Okay, Nick.
All right, thank you so much. And so, with the announcement of the budgeted $7 million for those 3 clinics that's helped in response to the pandemic, do you guys have an estimate of how much is set aside for GRMC, the non-COVID facility? How much is that?
We don't have any set aside for GRMC. GRMC is considered a hospital, and under the Cures Act, we actually were able to work back and forth with GRMC. That is one of the reasons we decided to go into the structure, so we can move resources back between the 2 hospitals. So there is no set aside for GRMC.
Can you say how much they paid? Sorry. They're being paid. The government paid them.
Paid to GRMC.
Okay. And so in the spending plan, it includes $3.5 million for credit card fees. So why does the team anticipate this much in fees, and how much has actually been collected by Reventax during this closure?
The question was asked earlier, and again, the amount is, the burden has shifted from the consumer to the government because of the social distancing, the stay-at-home requirement, and the desire that when we come out of this situation, we will have a different mindset. Sanitation, masks, social distancing, and more of a reliance on telework and paying your bills online. So, your credit card authorization, it's not like a check. It's not going to bounce. If your credit card comes through and it's approved, it's approved. So it's a secure and quick way of payment, but it also helped in this period of time when we wanted people to stay home. So Reventax is anything. We are just shifting the burden.
Thank you. Thank you, Nick. Okay, so Steve is out. All we have left is Mariana's Business Journal and John from Guam Daily Post. So, Mariana's Business Journal, Wayne Trugloff.
I actually have no further questions. Thank you very much.
Thank you. And all that we have left now is John.
All right, Governor. So this is another question regarding the spending plan. I know we have been talking about the various aspects of it, but there's 20 million in software for DOA and revenue tax to comply with the CARES Act reporting. What software program was this, and why is it such a significant expense? In addition to that, how was the software procured, and how long is the contract for, if any contract?
John, you're talking about the expenditures overall for the Department in light of this paradigm shift and being able to process things with less customer interaction and facilitation of the multitude of tasks the Department of Administration has to address HR, payroll, and procurement. So we have long sought for a new FMIS system. We've been looking to try to find a way to modernize our IT infrastructure. So the governor gave us the green light to set aside funding both at the Department of Revenue and Taxation and the Department of Administration to achieve this goal. We are in the dark ages when it comes to IT. We'd love to be able to try to be more customer service friendly, more organized, more efficient. So we believe that this allows for technological improvements to include the ability to telework, which is one of the primary eligible expenditures allowed under this funding source.
Thank you, Lester. These next few questions involves the recovery aspect. I know we probably won't be taking in tourists until peak or 3, but is there any consideration on lifting the 14-day quarantine requirement for travelers from South Korea, considering they do have extensive testing being conducted there? And other countries have opted to lift bans from them as well in order to help reopen our tourist market.
There's always a consideration about lifting. I mean, we're considering all the restrictions that we have put into place to lift them so we can try to get back into normal life as much as what we may have to redefine normalcy after this pandemic. And so there is always consideration. My concern would be, and also from the physicians group and also from the business community, is how can we lift the quarantine of incoming passengers and still feel that our community is still protected against this virus? That's the biggest challenge. And that's the same kind of question that the business community are very concerned about. And I just want to say that, the business community is working very closely with the medical community so that we can strike a balance, and so that when we do open and lift the restrictions on quarantine, that we are assured that we are decreasing, and our exposure to the coronavirus is going to be very, very minimal, and the risk is going to be very minimal. So the business community, John, is also just as concerned about it as I am. And as governor, I need to make sure that the balance is there, because my responsibility to provide safety and protect our people is very heavy and very serious. And I want to make sure we do things correctly the first time.
Thank you, Governor. Is there any consideration to supporting local hotel hotels other than those being used as quarantine facilities and isolation sites. Presumably, these hotels are also experiencing some cash flow issues with no tourists, and presumably no tourists are expected to come anytime soon.
I think the support there for the hotels, John, is through the PPP program, and of course, we have the SB, the business economic expenditure in our budget plan here. That's something may be done with that. But I think the major support would be the PPP loan program.
Thank you, Governor. And so I do have one more question, and I believe this question was asked last week. And this is also in light of all the other questions today regarding the procurement of the quarantine facilities, as well as the oversight hearing scheduled for the procurement. So we do know that one of the hotels, Packstar, took out a mortgage with the Bank of Guam. So what do you say to any concerns or criticisms that there's some sort of favoritism going on with the selection of these quarantine facilities and the payments that are being made to them? Do you have any comment regarding that?
I say that it's absolutely untrue. My interest in getting the Pacific Star is absolutely not in any kind of consideration about mortgage. I don't think that's something that should even be brought out because there is no truth to that. My biggest concern was having the option and having the capacity to quarantine these people who are coming in from hotspot. The time that we got the Pacific Star facility. By the way, Mary Rhodes also put out a email when we were trying to get the fourth one, and they were the ones to respond. And so as a result of that, we were able then to provide the capacity to quarantine these people. And at that time, the United States was really increasing. They were having hundreds of thousands of new cases weekly. They were having thousands of people dying weekly. There was a hotspot in New York. Hawaii actually followed our lead in these quarantine. So as you can see, again, we are the leaders in this whole measure of containing coronavirus. So John, I just want to assure you that my interest is not because it has a mortgage with Bank of Guam. My interest is the people of Guam. My interest is protecting the people of Guam. And as governor, if I did not meet up to my responsibility, then it's not the trust that the people of Guam have given me when they elected is not being carried out. So any kind of notion about that is totally untrue.
So the response to any kind of implications of favoritism or illegalities is that's not true.
It's totally unfounded. Many were not interested in being a quarantine facility. The hotels were afraid that they were going to be branded as quarantine, and they were concerned about their ability to attract tourists and for tourists to come to their facilities. So, again, John, this pandemic situation is, like I said, a lot of uncertainties. It has impacted our economy in the worst way. I mean, even people are saying, even in World War II, this kind of crisis wasn't the kinds of deaths that we are seeing globally and nationally is, it's tragic. It's a tragedy. It's many lives are lost. Loved ones are lost. Fortunately, we only had a fatality of 5. But even that, I think, was too much for our people here. So again, my whole focus is very much towards protecting and very much of doing what the people of Guam have entrusted in me, and that is to protect their health and their safety.
Thank you, Governor.
Do we have? We only have 2 reporters left, Nick and John.
Yes, I just have one follow-up that just came in, if I can ask.
Okay, go
real quickly. It's a response that Senator James Moylan just sent in a letter that he titled, "Governor, we need to do more," saying, "Unfortunately, your plan is not sufficient." And so I just wanted to get your response to that. He notes the good parts of the plan and appreciates the $300 for individuals that those that qualify, but his words, the plan is not sufficient.
I don't think any plan is totally sufficient in its own single way. There's a multitude of plans and programs that will make it sufficient. And for me, how we are sufficient in the well-being of our people is when we beat this coronavirus and we come back to normal life and we rebuild our economy and our people start really now behaving the way our culture behaves. I mean, just the fact that you can't hug your grandchild or I can't even go see my mother is just so disheartening. And I know everyone is faced with the same situation. So we need to get the plans, and not one single plan, like I said, is sufficient. There's a multitude of plans that we are using, and we are going to be initiating and implementing, and I think that's how we'll be able. So the goal is to really work it so we can get back to some normalcy and we can continue with the well-being of our people.
Governor Lester, Dr. Hernandez, thank you guys so much for your time and for the added time today.
Thanks, Nick. John, do you have one last question? Okay. Oh, wait, I'm sorry. Go ahead, John.
No, I don't. Okay. Thank you.
Thanks, John. Thank you, everybody. Thank you, Governor. Thank you, Lester.
Thank you.
Thank you, Ricky.